Hello, this is Dr. Meyer coming to you from East Bay Disc Centers in Concord, California. And we have our new patient, relatively new patient, Kevin, on our decompression table here. And he came in today. He has had 6 or 7 decompression sessions so far, which is really not very many. I'm going to ask him to just tell us how he was feeling before starting, what brought him in, and then he can share with you what he told me about how he's feeling today. So to have you turn your head minimally, why don't you tell us how were things, why did you come in? What was up?
All right, so I came in because I was dealing with chronic back pains where I could barely stand up, I could barely touch my toes, I could barely do anything like that. And it was hurting for a whole month straight to a point where it was enabling me to drive my vehicle, enabling me to go upstairs, do it downstairs. Also, it prevented me from doing certain things at work. I need to lift heavy things, so you gotta use your back. And it was just hurting like crazy. As soon as I came here, not gonna lie, I know there's always ups and downs of pain and stuff like that. But the last week or so, I've been feeling amazing. No pains, no issues, no nothing. It feels amazing, and I'm happy to actually be getting the treatment that I deserved. I'm a combat veteran that's been having a lot of back pains from way back when I got out, and the VA said that it's just because of my weight or because I don't work out and stuff like that, and I used to work out a lot, so it made no sense to me.
Right.
But now I feel a lot better.
Right, and I'm in complete disagreement with that as well. So I agree with you and your position. Kevin, how old are you?
I am 33 years old.
33 years old, okay. So we know the average 33-year-old does not experience the kind of back pain that you were having that brought you in here.
Correct.
And so thank goodness that you came in here, because a lot of people don't have any idea about spinal decompression. They don't know what it is. They don't realize that there's an alternative to dealing with the pain, or when the doctor says your only hope is to have surgery. And so I'm just curious, would you recommend this type of treatment to anyone else?
Without a moment of my, I feel like this is the best treatment ever. I recommend it no matter what. If somebody says it's just because of your weight or something like that, I recommend seeking professional opinions.
Right.
Don't listen to the doctors, because sometimes they don't know what they're talking about, especially in the VA. I feel like they were just looking past it. They're like, oh, this guy's just trying to get a claim for his back, but I really had back issues, and it hurt a lot.
Great, and just to be clear about that, I mean, you chose to have this treatment. You are paying out of pocket. You're paying your own money for this. So clearly you're not doing that, to just have a claim.
Correct.
So we want other people out there to understand that if they are suffering, and whether their insurance will help to cover any chiropractic care or not, decompression is not covered by any insurance, but it is one of the very few options that people have. But it's non-invasive. There are no drugs. In fact, we usually get people off their medications relatively quickly. And we tell people between 2 to 4 weeks is what the average person requires to start feeling better. But for you to be virtually pain-free now at less than 4 weeks is really phenomenal. So I just want to say thank you so much for being willing to do this, and even while I'm holding this, while you're laying on your back here on the table. But then people can actually see what this is like, and you don't look like you're in any pain while you're having the therapy here.
It's pain-free.
Yeah, and it just has amazing results. So Kevin, thank you very much. I'm thrilled with your progress, and I look forward to making even more with you.
No problem.
All right.